Story 1. My friend's mother showed me her MRI scans at a dinner party before her appointment with the neurologist. The report and images indicated features consistent with multiple sclerosis. I didn't want to have that conversation, so I pretended not to understand and advised her to discuss it with her doctor. My mother was upset with me for acting like I didn't know anything. I made it clear that I would not provide any informal medical advice to her friends in the future. Story 2. I remember the time my uncle sent me an unsolicited picture of his anus, asking if it was a hemorrhoid. Story 3. I wish I had a funny or less depressing answer, but during training, I ended up diagnosing and confirming cancer in a friend from my hometown when he asked me why he sweats through his sheets every night. He is now cancer-free and in remission, but he no longer talks to me. Story 4. I have a story of the reverse. I asked my doctor friend about my brain MRI. I had one done to investigate why my voice was so affected, and being curious, I looked at my scan when I got home. I texted my friend and asked what the white and hazy areas on a brain scan meant, and they offered to look at the files. I sent them over. Their response was professional and informative. I was diagnosed with brain cancer a month later. This was about 3 years ago. My cancer was treated, and I am still stable. My voice issues were unrelated and probably an aftereffect of COVID-19. I still think about the fact that my friend probably knew what was going on with my brain that day, which must have been hard for them. Story 5. A friend of my then-boyfriend asked me how to know if you have syphilis one day out of the blue. I inquired why he was wondering, and he said he was just curious. Sure, Bert, we're all curious. However, if you feel the need to know if you have syphilis, there is a high chance you have engaged in risky behavior and should get yourself checked out. He went to the doctor and was diagnosed with syphilis. Story 6. I asked my dad's doctor friend to check my testicles for cancer when I was 14 and found a lump. He actually said, "Let the dog see the rabbit," when I was dropping my pants, and it made me laugh. So that was good. Turns out a lot of guys just have lumps on their testicles. I also learned that doctors genuinely don't care if you're their friend's son. They just see the case, which was quite interesting. His daughter had a crush on me and was friends with my sister, and all I could think about on the way home was, is he going to tell her about my private parts now? I realize now how naive I was. Story 7. I am a patient. At one of my low points in life, I became obsessed with watching videos about people living with diseases and acquired immunodeficiency syndrome. I started to think I might have the condition too, mainly because I was tired all the time. I went to my general practitioner and asked, "How do you know if you have acquired immunodeficiency syndrome?" She looked shocked for a moment, as if she recalled every interaction we'd ever had, then calmly said, "If you think there's a chance, let's do a test. I don't have acquired immunodeficiency syndrome. I have anxiety." Story 8. The patient. My wife had a cloudy spot on a brain MRI. They told us it is likely an astrocytoma, which is a type of brain tumor. My best friend is a radiologist, so I talked to him about it. He explained that there are 4 grades. Grade 1 is more common in children. Grades 2 and 3 are randomly distributed in the population. Then he said grade 4 is typically associated with older males, and if you get it, the prognosis is poor. We laughed because my wife is not an older male, so she would probably have grade 2 or 3, which surgery and chemotherapy can treat. About a week later, we received the lab results from the biopsy. My wife had grade 4 glioblastoma multiforme, which has an average life expectancy of about 18 months. It was the type that repairs itself quickly after chemotherapy. My wife lasted nearly 18 months before she passed away. I'm sure my friend regrets the casual way he described the possible outcomes to me, but the straightforward talk is how we communicate, so it didn't damage our relationship. Story 9. My mother once called me because she hurt her ankle and wanted to know if it was broken or just sprained. She got upset when I explained that I am a nurse in a completely unrelated field and that no one can differentiate a sprain from a simple fracture over the phone without an X-ray or at least an examination. Story 10. I am not a doctor, but rather a critical care paramedic. A longtime friend asked me to clarify notes she received from her boyfriend's oncology visit. She wanted me to translate the medical terminology. It was one of the worst reports I have ever seen, and I was amazed he was still alive. She remained hopeful and clearly wished for the best outcome. I gently told her that I was not the right person to discuss the report with her. He passed away about a week later. Story 11. I am not a doctor, but I am a respiratory therapist. During one of the waves of COVID-19, one of our laboratory technicians' mothers was admitted and was on a bilevel positive airway pressure machine with COVID-19. One night, while we were both working, she asked me how her mother was doing. I told her I didn't want to tell her because I was not going to lie to her. She insisted that she wanted to know. Everyone I have had on these high settings on the bilevel positive airway pressure machine has died. That's not to say we aren't going to keep trying, but I want to be realistic with you. She started crying. She had just lost her grandmother a week prior, so this was quite difficult. Up until that point, apparently no one had been honest enough to tell her just how serious her mother's COVID-19 condition was. Story 12. My wife's cousin wanted me to see if his testicles had shrunk from using steroids. I politely declined. Story 13. Let me start by saying this was almost 20 years ago, and I was not the medical person, but at the time I was starting classes for my certified nursing assistant. At that time, my grandfather was being treated for lung cancer, and I asked one of my teachers what metastasis in the liver meant, which is how I found out my grandfather wasn't going to beat the cancer. To his credit, when the teacher figured out why I was asking, he was exceedingly kind, but it was obviously really upsetting for both of us. About 3 months later, my grandpa passed peacefully at home with his family there. While it was hard to hear at the time, I'm grateful for that teacher telling me the truth, so I was able to make good use of the time I had left with my grandpa. Story 14. Nurse here. I had to interpret my mother's MRI results to her since they appeared in my chart before she could talk to her doctor. It showed metastatic brain lesions from her intraocular lymphoma, which is terminal. I have never regretted being in the medical field more than I did in that moment. Story 15. Not a proper doctor, but I am a retired combat medic, and I've been asked a couple of odd questions. At a Christmas party for a charity that my ex used to work with, I started chatting with the charity's founder. Naturally, we got around to, "Oh, your ex's partner? You're not in education too? Oh, cool. If you don't mind taking a look at something for me." He had slipped on the stairs a few days earlier and had a bit of an ache in his upper arm. He wasn't sure if it was worth going to a doctor. I took a look for him because why not? I'm accommodating. To my surprise, his humerus was broken. Felt as though it was clear through the bone, midway. It wasn't displaced, but it was grinding a bit when he moved his arm. That was a fun one to explain. Story 16. I am a sonographer. A friend from my sports team sent me her images from an ultrasound of a breast mass. The results were concerning. Story 17. Occasionally, though less often as I and my circle grow older, someone will ask, "What is the worst thing you've ever seen?" The answer is something I have been trying very hard to avoid thinking about, no matter what it is. The worst thing I have ever seen is likely something I cannot remember, and I have done so deliberately. Story 18. Not a doctor, but I had one of the hardest conversations in my life with my little cousin, who was 13 at the time. He was born with underdeveloped kidneys and was diagnosed with chronic kidney insufficiency as a 2-month-old baby. Doctors predicted he could live with medication only until the age of 5. He lasted until 13, and then he had to start dialysis. His mother was never supportive. She would just shut down, and the rest of the family would have to pick up the slack. I will never forget visiting him in the hospital the day they told him that his only treatment options were dialysis or a kidney transplant. He asked me what dialysis was, and I explained it to him carefully. When I finished, he asked if that meant he would have to do it his whole life. I didn't want to lie to him, but I did not want to upset a 13-year-old who already had no father, a detached mother, and whose only chance to live depended on being hooked up to a machine 3 times a week. I assured him it would only be until he received a new, healthy kidney, and I hoped that would happen soon because children are a priority in these situations. No matter what, he had our love and support to get through it. He asked me who would give him the kidney. His mother was afraid to undergo surgery and did not want to do it. Others either did not match or were not in good health to donate. This meant he was put on a waiting list. I didn't have the heart to explain that process to him, so I made up a story that sometimes people are willing to help others by donating their kidneys, leaving out the dying part. I will never forget how much I cried outside the hospital, but I never let him see me worried. He had so much trust in me because I never lied to him. I just created stories that excluded the harsh realities. His mother never provided him with that kind of support, so whenever medical staff saw me there, they would always let me in, even when I would just stop by to bring him clean clothes. Doctors and nurses knew better than I did how unstable a parent he had. I forgot to mention that he was sad and cried about not wanting to take anyone's kidney because he didn't want someone to give up theirs for him. He was such an empathetic child. Sadly, he passed away 3 years later due to complications from the transplant surgery. We had many difficult conversations during that time, and his passing is one of the hardest losses in my life, especially because I was more like a mother to him than a cousin, with only a 13-year age gap between us. Story 19. I am not a doctor or medical professional at all. I grew up in a small town where everyone's phone number started with the same 3-digit exchange. In my mid-teens, the town had finally grown enough that a second phone exchange was needed. A new doctor's office ended up with a number on the new exchange that had the same last 4 digits as my family's home. We would receive so many wrong numbers where, the moment we answered, the caller would launch into the most graphic description of various body parts oozing various fluids. I understand people mistaking us for the doctor's office, but I was baffled that they thought the doctor was answering their office phone directly and not a receptionist. Story 20. Not a doctor, but a former anesthesia-registered nurse here. The worst question I experienced was my mom asking if she was going to be all right after they found a €2 coin-sized melanoma on her back. The tumor was showing dendrites when she finally went to the doctor. The positron emission tomography scan they did a few weeks later lit up like a Christmas tree. Due to some trial medications, she managed to survive past 2 years, which is a miracle in itself. In the end, though, the cancer won. The second worst experience was people asking what the most horrible case I had seen in the operating room was. It is not something you want to talk about or be reminded of. I usually answer, it's the kids that hit hardest. And it is so true. Story 21. I am not a doctor, but I am a paramedic and I think this fits well. My dad and mom called me because my dad was feeling dizzy. He was lying down and they checked his blood pressure. It was fine. I conducted the usual questioning and asked him to sit up and take his blood pressure again, which turned out to be low. After asking a few more questions, my dad revealed that he had taken Viagra, and the dizziness started after they were intimate. It turns out that his new blood pressure medication and anxiety medication, which he has been taking as needed, were both taken that day. He had never taken both medications on the same day before. Both affect blood pressure, and the combination was most likely the cause of his issues. I was relieved to help before he walked around and potentially passed out or took both medications again another time. However, I could have lived my whole life without that knowledge. Story 22. My best friend's cousin dropped his pants as soon as I arrived at the party and was in the kitchen. He asked, "What's this rash on my penis?" It was herpes. Story 23. My husband's uncle asked me how many days after urination one could still drink their own urine. I wish he had not asked that. Story 24. Not sure if this counts. I'm not a doctor, but I work in a hospital in the medical field, so my family thinks I'm an expert. My mom ended up in the hospital after a series of falls. She had an MRI scan followed by emergency surgery. The surgeon wrote up the report for my mom's family doctor, but it was in another language that my dad doesn't speak, so he forwarded it to me. My mother had a bowel tumor about 4 years earlier, and it had metastasized to the brain, resulting in 2 distinct tumors, with the second proving inoperable. 3 months later, she was gone. Story 25. I am a second-year medical student, so I am not a doctor yet and have not been through residency. I get asked by family and friends at least twice a month to interpret lab work, imaging reports, and diagnose symptoms. I usually don't mind, but it always comes at the worst time when I am cramming for an exam in class or busy in a healthcare setting. Recently, I visited my parents and a family friend was over. They shoved a phone in my face with my chart results pulled up, wanting me to interpret imaging and lab results before their doctor had contacted them. I held my tongue and refused. Their degenerative spine condition was a mess and had progressed to needing surgery. It was not my place to tell them. My sister, who has atopic dermatitis, just sent me a photo of an arm rash. I probably get half a dozen such requests from her each year. It's always the same diagnosis, but she is my sister, so I don't mind. It is bad medicine to diagnose without performing a clinical exam. I dislike diagnosing with just a complete blood count or a blurry phone picture. It is better to see the patient and include a physical exam before drawing conclusions. Some things are straightforward, but most exist in gray areas. There is nuance and context that results and imaging simply cannot clarify. There is an art to medicine, and these human elements are significant reasons we could never be replaced by artificial intelligence or any basic language model. We are nowhere near the point of artificial intelligence singularity. At that point, most jobs would be replaced by AIs. The worst moment was seeing my favorite aunt develop dementia. I noticed the signs about a year before diagnosis, and we suggested they see a neurologist. My aunt waited months, and when she finally went, she was diagnosed. My cousins are upset and trying various ineffective remedies and lifestyle interventions in hopes of reversing it. I do not have the heart to tell them that the disease is irreversible and that they should focus on quality of life, enjoying their time together, which they are now doing, and advance directives and care planning rather than attempting crossword puzzles and word games. They ask me many questions but then decide to ignore the medical information I provide. I like to be helpful and answer medical questions, making it easier to understand for the people in my life. It is a passion and I find it enjoyable. I want to make the world a better place, and this is how I see myself best positioned to do so in my own way. However, there needs to be a limit and a full understanding that, 1. I am not far along enough in my training. There is a reason we study and train as long and as intensely as we do. The years, hours, intensity, and details of physician education and residency are immense. This is not comparable to college or a master's or nursing degree, and I greatly respect nurses. Nor is it like an online mid-level degree. It is unique and intense. I must be genuinely crazy for undertaking this path, sacrificing my 20s and early 30s, and accumulating over $300,000 in debt plus interest. I am 2 years into intense training but have a minimum of 6 more years, which includes 3 stages of board exams, over 10,000 hours of residency, more of surgical, challenges from insurance companies, hospital administration, and patients, along with many 60 to 80-hour work weeks that include back-to-back nights and weekend calls before I am close to being ready. This is overwhelming and unquestionably unhealthy. Yet it is what I want. Imagine studying and training for years, only to realize that we truly do not know everything. The more I learn, the more I question whether I have what it takes to conquer what I am unaware that I do not know. There is a lot of pressure we place on ourselves to be perfect, even though that is impossible. Does that make sense? It is a lifetime of learning and revising. So please, cut me some slack. My profession is governed by law, medical professionalism, ethics, and morals. Regardless of the clarity of the law, there are other standards, oaths, and professional ethics we must adhere to. I will have both a legal and moral obligation to my patients. I am ethically obligated to preserve a patient-physician relationship, yet anything outside of that is not legally protected without formally establishing care. If I cannot establish care, I am morally, legally, and ethically obligated to transfer care, either through referral to another physician or by assisting patients in obtaining emergency medical care. Story 26. My sister asked if it was bad that her white blood cell count was in the 20s. I was worried until she said it was a typo. Story 27. I am not a doctor. I was a healthcare assistant in accident and emergency. I do know some things, but I am not a nurse or a doctor. My mother-in-law mentioned some things to my husband, which he reiterated to me. I realized that 2 of those things relate to cancer, but I never said anything because I am not a doctor or in the cancer field. It was just some information I picked up along the way. She was told she was receiving palliative care for cancer and decided to break the news to my husband. She said, "I thought you would have told him." Story 28. When my brother graduated from medical school, All my friends sent him pictures of their testicles, asking if they looked strange. I thought it was funny, but he was not happy with me. One of my friends actually had an unusual testicle and needed to see a dermatologist to have a mole examined. Turned out to be nothing, but it was still hilarious. Story 29. I am not a doctor, but a nurse. My background is exclusively in women's health and the neonatal intensive care unit. The number of times my grandfather has asked me about his prostate has made me dread visiting him. Story 30. Not my own story, but a woman I know who is a doctor nearly died giving birth due to a hemorrhage. She recalls hearing the medical staff discussing her condition and realizing just how close she was to dying. She wished she didn't understand the terminology. Story 31. Dude, you're a medic, right? I have this foot issue. I have a tray of food in my hands, so please leave me alone. Story 32. Not a doctor, but a husband to one. We were eating at a fancy restaurant when she had to stop and explain to a mother that her child had cancer and that she too would need emergency surgery for her current diagnosis. 5 minutes later, she had to make another call when a relative found out that their uncle also had cancer. All three passed away within months. Story 33. I am a paramedic. My sister called me after the staff informed her that our grandma was not well and needed to go to the hospital. She asked if I thought an ambulance was necessary. I learned that grandma had an oxygen saturation of 70%, which is very concerning. I calmly recommended that she take an ambulance, explaining that it would be easier. Later, I received an update from the hospital indicating that grandma was moved to a resuscitation room for more treatment. I struggled not to correct her by pointing out that the correct term is resus, short for resuscitation. Amazingly, grandma had a severe pneumonia but pulled through and is doing fantastic. Story 34. Obligatory note. I am not a doctor, but a patient in this case. I am recovering from a failed suicide attempt after consuming a full bottle of hydrocodone mixed with beer, which resulted in kidney and liver damage. After explaining my reasons to the doctor, I saw the pain in his eyes and the eyes of the two nurses. I remember how he sighed heavily before speaking to my family outside the room. I could only imagine what he was thinking, but I commend him for being very professional. I recall my older sister asking the doctor directly, why would he try to end his life? There was a long pause, and then the doctor empathetically explained what I had told him to her and my older brother. Story 35. I am not a doctor, but I underwent testing and an ultrasound for a large mass in my thyroid. I had my ultrasound on my birthday and watched the screen as they took images. I could see a clear difference in the tissues. I went home and looked up thyroid cancer ultrasound images, and they looked exactly the same. They sent me for a needle biopsy to confirm after the ultrasound. When they finally called with the cancer news 2 weeks later, I already knew. I had my thyroid removed. I have been cancer-free for almost 4 years now. Story 36. A friend I have known for 15 to 20 years recently confessed to having borderline personality disorder. I was taken aback by this revelation. You have a significant cocaine addiction and were never suicidal before you started using and running out of cocaine. Story 37. A friend of mine asked me to check out a strange rash he was developing. I took one look and told him he needed to stop masturbating. He asked me why, and I explained that I couldn't get a good look at the rash with him moving around so much. Story 38. As a dentist, friends often ask if I can tell if someone has performed oral sex. When I explain that there are some signs I can observe in the mouth, I can see the realization in my patients. I have often wondered why people ask this, as now many seem to consider their dental appointments before engaging in such an act. Story 39. I asked my doctor to check a lump on my backside. He ignored me when I showed him and continued with his shopping in the supermarket. Story 40. I reviewed my father's scans and lab results and discovered that he had liver cancer, specifically melanoma that had metastasized to the liver. The doctors avoided direct communication and provided my parents with false hope. I was aware of the situation. He passed away 7 days later. Story 41. Not a doctor, but since people are telling stories, my grandmother, a former nurse, asked me to take her to her doctor's appointment. which involved a routine chest X-ray. I was a nurse working in radiology at the time, and I knew the technician at the office. I was able to see her X-ray immediately after it was taken. She had a large mass in her chest and pleural effusion. How she wasn't symptomatic was beyond me. I must have had a look on my face because she said, "I've got cancer, don't I?" She passed away less than a month later. Story 42. Hi. I'm falling from an exploded plane. I can either skydive and aim towards a haystack or the sea, and I have some coins in my pocket that I can throw in to break the waves before I splash down. The question is, which option will do me less damage? Story 43. How to lose weight. I will discuss the calorie deficit, but it seems that people often prefer an easy solution or validation of their beliefs, yet they rarely follow the advice given. Story 44. Why are COVID vaccines causing cancer? Even if I wish it weren't like this, our friendship isn't the same anymore. Story 45. I'm not a doctor, but I am a dentist. When I diagnosed herpes in my underage cousin, I kept it a secret because her parents are very strict. Story 46. Cook here. Nothing related to doctors or hospitals. A coworker who had become a close friend told me about his roommate, and I advised him to check for human papillomavirus as soon as possible. He took the test and it came back positive. It doesn't matter if it was from his roommate or something else. Now he has human papillomavirus. He was a 60-year-old Brazilian man, illiterate as I could see from his Facebook, and he was in panic, almost crying. I'm too tired to elaborate. He confused human papillomavirus with human immunodeficiency virus. The doctor even explained what human papillomavirus is, but he said, after he told me it's incurable, I did not listen to anything else. I just thought that I'm going to die. Story 47. What is wrong with my child? Not everyone appreciates unsolicited advice on parenting or their children, or believes in mental health diagnoses. If I were to tell them their child has attention deficit hyperactivity disorder and that they should have it treated immediately to avoid future problems, it is not always well received. Therefore, I mostly remain silent unless they ask. No one ever does. Story 48. Not a medical doctor. I have a PhD in the humanities. My first interaction after my defense was small talk with a clerk at a hotel near the university. She asked about my day, and I told her I had just defended my dissertation and was now officially a doctor. She then asked me a question about a skin condition. Story 49. Not a doctor, but I'm guessing it's something like, can you get a name of an STD from doing a name of something unusual that you wish you didn't know your friend was into? Story 50. My wife's friend asked me if she should fly to the capital for a faster liver transplant for her 2-year-old son, based on the advice of her husband's distant relative who is also a doctor there. The relative assured them that the child would quickly receive his transplant. They ended up waiting another 3 months. Had they stayed, it would have happened in 2 weeks. My advice was to stay, as the two cities have very contrasting weather. She had already waited 6 months and was close to receiving the organ. The food has very different flavors. It would cost them a lot of money for accommodation, and she would have to go without her husband since he still works. Additionally, this was after I advised her to take the child to another pediatrician because he had a bloated belly. She stayed with the same doctor for 2 to 3 months, who dismissed his condition and focused more on his sinusitis, which was pollution-related. Story 51. I am not a doctor, just someone who studies first aid and medicine as a hobby. A friend learned about my interest in medicine and insisted that I look at his injury. He had accidentally cut himself with a box cutter he left in his pocket. I told him it wasn't necessary to show me. He just needed to refrain from using it for a while so it could heal, which it would do quickly. Story 52. My brother is a doctor. When he was a medical student, a girl at a wedding mentioned that she had an unpleasant odor. She asked him if she might have bacterial vaginosis. Story 53. When my father-in-law had cancer, my family was sending me his CT scans, lab results, and anything else to interpret the situation. Absolutely not, especially not in such awful circumstances. I spoke frankly with my husband, who is accustomed to blunt medical conversations, but I made him not relay information to his family. They needed to speak with his care team for any details. My entire family works in medicine. We represent multiple specialties and practice areas. I have come to understand our conversations are rather different from most people's dinner discussions. When it comes to medical issues, we tend to be straightforward. I am the only member of my husband's family who has a medical background. I will not share opinions with anyone in his family because I do not want them to direct anger towards the messenger. Having worked in high-stress environments, I have seen family members turn on the one individual with medical knowledge in their own families. The only time I shared information with anyone else was when my husband had an uncle in the hospital for a temporary, though severe, illness. His mother and aunts were so relieved that their brother was improving after a successful surgery. We all went to visit. On the way home, they commented on how good he looked and turned to ask me what I thought. I was young and blurted out, "He'll be transferred to the intensive care unit by tomorrow. He looks terrible." I was completely correct. He deteriorated and was transferred at 10 p.m. that night, staying for another week before moving to a different unit and truly recovering. His mother was impressed and thanked me for the warning. The other aunts were upset I couldn't somehow prevent it from happening if I knew about it. Story 54. I went to the emergency room with an acquaintance to get his chest and abdominal x-rays, only to watch with the technician as the computed tomography scanner slowly revealed a sea of white. Metastatic stomach cancer. It was a long walk back with him to his cubicle. No words were spoken, but he could read my face. Story 55. My hemoglobin and platelet levels were half of what they should be. My white cell counts were about 5 times what they should be. Acute leukemia is a rapidly progressing disease. Most of my symptoms developed within a month, and it's not entirely clear how long I may have had it prior to the onset of symptoms. I was 27 and otherwise fit and healthy, so I hadn't visited the doctor in a long time and hadn't had any blood work done to refer back to. Story 56. I don't know about wish they hadn't, because I was happy to be there for my friend. I was an emergency medical technician and also worked in hospitals and eventually in specialized medical technician roles. A friend of mine received her lab results in her online medical portal late at night and couldn't talk to her doctor until the morning. I had to explain to her at 23 years old that she had type 2 diabetes. It was not good news, and since it was during COVID, that made it extra scary for her. Story 57. I'm a practicing surgeon, and being a surgeon in the UK differs from being a doctor. One of my former patients asked me, "Are you sure you know what you are doing?" It was the wrong time to ask, as I was about to remove their liver. I also realized I forgot something. Anesthetic. Story 58. We were at a friend's birthday party where we rented a place to spend a couple of nights. I'm a male nurse, and my friend was dating a girl at the party, but they had recently broken up, so he wasn't invited. She showed up in a skinny red bikini at the hot tubs and hit it off with another guy, resulting in loud sex that night. It was pretty awkward. Everybody could hear, and it definitely made a statement. The next morning, she said she had a bump on her labia and thought it might be herpes. She asked if I could take a look. I quickly declined, saying that she would need a test anyway, so my looking at it wouldn't change anything. I advised her to see her doctor and to stop being so open about her private life. We understood she was single. Story 59. I'm not a doctor nor a patient with a story, but I enjoy telling my Grandpa Earl's story because it is remarkable. He served in the military for a significant time and saw combat, though like many veterans, he rarely talked about it. After retiring, he was involved in a severe car accident. Initially, he didn't think anything was wrong and showed no visible side effects from the crash. He visited doctors who did not notice anything major. Over the years, he began to experience serious issues. His fingers started locking up, he lost control of them, and he experienced numbness and persistent neck pain without understanding why. He could not lay down in a bed and had to sleep in his recliner. It was difficult for him. Eventually, my grandma convinced him to go to the hospital. Men often struggle with pride and admitting when we are hurt. The doctors performed scans and were baffled by their findings. It turned out that during the car accident, my grandpa had broken his neck, and when he first visited the doctors, they somehow missed it. He lived for over 8 years with a broken and ultimately misaligned neck. By the time they finally diagnosed it, there was permanent damage to his neck, muscles, and nerves, preventing him from regaining full control of his hands, and he continued to experience neck pain. That did not stop him, though. He continued woodworking in the garage, creating beautiful wooden cars. He made one for his wife, 3 for each of his daughters, and 8 for his grandkids. He loved working and watching baseball, specifically the Indians or the Reds, as we are from Ohio. He passed away in 2013, and I think about this story often because of how extraordinary it is and how resilient that old man was for enduring so much throughout his life. I use this story as a reminder to keep my ego in check and to seek medical attention if I suspect something is wrong. There's no reason to jeopardize what little life we have. It's essential to get checked if something seems off. Story 60. My friend asked me what melanoma looks like and how she could develop it. I told her that if she had a mole that appeared suspicious, she could send me a picture of it. Over the following weeks, she sent me a total of 62 pictures of all the moles on her body, and she continues to send more. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.